Okay, welcome back guys. I am Dr. Klim Raza. In this lecture we are going to discuss about the carpal tunnel, Guyon canal, and what is the difference between carpal tunnel syndrome and the Guyon canal syndrome. So first of all we have to understand the anatomy of the carpal tunnel and the Guyon canal. Here you can see this is the structure from your Snell anatomy, but it might confuse you. There are a lot of structures here. So let me draw first the carpal tunnel and then you will have understanding of this structure. Okay, so carpal tunnel, this is a small tunnel at your wrist joint, and you know that wherever you have got tunnel you will have the floor, you will have roof also, and the purpose of this tunnel, especially the carpal tunnel, is to preserve the structure which is very important. That structure is having basically lot of important functions. It's coming from all roots of the brachial plexus, and that structure is the median nerve, also called as labral nerve. So if I am able to write holding this pen, this is also a function of the median nerve. So overall function of this tunnel is to preserve the median nerve. So first we have to understand that what is the basically structure, infrastructure of the tunnel, how this tunnel is basically formed by the nature, and what are the structures in the roof and on the floor of the tunnel. So in floor, suppose I am drawing the tunnel of the right my hand, so I will draw the floor. So as we know that we have got eight carpal bones, we have got 4 carpal bones in the proximal row, we have got 4 carpal bones in the distal row. So those who are in distal row, they are basically are the floor of the tunnel. So what are the bones in the distal row, carpal bones? We know that first bone in distal row is basically trapezium. So suppose this is your trapezium bone, and we have got trapezoid also. Then we have got capitate also. So this is basically capitate, and then we have got hamate bone, which is having special hook also. So this is our hamate. So in this way guys, you have to focus that these are the 4 bones on the floor, and these are the carpal bones of the distal row, that we have got trapezium, trapezoid, capitate, hamate. Just in front of trapezium we have got scaphoid, and we have got other bones also which are in proximal row, like lunate also, triquetrum, pisiform. But these 4 are the bones of the distal row which are on the floor of the tunnel. And above these carpal bones we have got 4 tendons. And what are those tendons? So these are the tendons of anterior compartment muscles, and these are basically flexor, they are inserting here. So we have got 4 tendons of flexor digitorum, fundus, profundus. So fundus base, so we have got 4 tendons of the flexor digitorum profundus, flexor digitorum profundus muscles, flexor digitorum profundus. So carpal bones, then we have got 4 tendons, flexor digitorum profundus, flexor digitorum profundus. Fundus mean base, so these are the tendons on the base. Then how the roof of the tunnel is basically made up of, it's also made up of 4 tendons. So we have got 4 tendons on the roof, and these are also tendons of the flexor muscles, and these are on the roof superior side. So these are called as superficialis tendons. So these are also flexors. So these are called as flexor digitorum superficialis, flexor digitorum superficialis. So flexor digitorum profundus on the base, flexor digitorum superficialis on the roof. And above these tendons we have got special special covering of this roof, like a ceiling of the roof. So this is a special connective tissue sheath, and this is called as flexor retinaculum. I am writing in short like FR. So this is flexor retinaculum, flexor retinaculum. So in this way you can, you know, give a shape to the tunnel. And the structure inside the tunnel, I have told you that structure which is preserved here, that is your median nerve. So suppose this is median nerve here, and this is median nerve, and this median nerve is further, you know, preserved laterally also by two tendons. So one tendon here on the outer side is basically flexor carpi radialis. Later I will show you the structure. This is flexor carpi radialis tendon, flexor carpi radialis tendon. And then on the lower part we have got another tendon, and this tendon is flexor pollicis longus tendon, flexor pollicis longus. So in this way overall you have got 10 tendons which help in, you know, protection of the median nerve in carpal tunnel. So here you can see the roof, the floor. On the lateral side you have got basically flexor carpi radialis. On the lower part, just, you know, near to this trapezium bone and trapezoid bone, we have got flexor pollicis longus tendon. Here you can see, you know, that carpal bones, injuries of the carpal bones, dislocations are very common, especially when you, you know, have outstretched hand injuries. Whenever you will fall, you know, you will stretch your hand, outstretched hand injuries lead to dislocation, fractures of, you know, these bones. So if any fracture to these bones or dislocation, it means you will have probably injury to, you know, these anatomical structures. So that's why carpal tunnel, you know, basically entrapment of this nerve in carpal tunnel is very common. Or in case of the pregnancy, in case of the diabetes, in case of the acromegaly, hypothyroidism, hyperthyroidism, whenever, you know, you have got these risk factors, so entrapment of this structure in this, you know, tunnel, that lead to the development of the sign and symptoms, that is called as, you know, syndrome. So carpal tunnel syndrome, if you have problem with this nerve which supply to the lateral 3.5 finger, it means you have problem in this part, you will have numbness, paresthesia, you have got tingling also, especially if you will tap this part. This is called as tinal signs. So you have got tingling sensations. This is your thenar muscle, thenar eminence. And if you will flex your wrist, you will have severe pain. So this is also called as phalanx signs. So remember that in some cases, you know, in severe entrapment, severe injury to the median nerve, there will be a paralysis, flattening of this, you know, thenar muscle, and that is a sign that patient is suffering from, you know, entrapment, injury to the median nerve, but sensations will remain intact. Why the sensations will remain intact? Because the palmar cutaneous branch of median nerve is passing basically outside this tunnel. So this is which branch of the median nerve? This is palmar cutaneous branch. Palmar cutaneous branch. It's outside the tunnel. So that's why in case of entrapment of this nerve, in case of the carpal tunnel compression, skin sensations of this part, this thenar eminence, are still intact. This is sometimes asked in exam. This is very important to understand that palmar cutaneous branch is basically passing outside the tunnel. You have to understand. And then you know, this will be lateral side, this will be medial side. On the medial side, this medial 1.5 finger, this is innervated by your ulnar nerve, and ulnar nerve is also preserved in one you know, small tunnel. And it shows that how, you know, nature loves these nerves, and nature have preserved these nerves in special, you know, tunnels. So this is small tunnel on the medial side. So this is called as Guyon canal. So here you can see this is your Guyon canal. So this tunnel is called as Guyon canal. So this canal is basically preserving your two important structures. One is your ulnar nerve, and other is your ulnar artery. So two structures are preserved in Guyon canal. One is ulnar nerve, other is ulnar artery. So this is here on the medial side. So if any fracture to the hook of the hamate, it also lead to injury of, you know, this ulnar nerve, because this is on the medial side. So normally what happens, that if you are cyclist, and you know that whenever you will apply the pressure on the handlebar of the cycle, it's like this. So you are compressing this Guyon canal. So that's why the compression of the ulnar nerve in the cyclist is very common, and that lead to entrapment injury of this ulnar nerve. That is called as Guyon canal syndrome. You may have one question in your exam, and then the background and history they will ask the patient is suffering from this much problem on the medial side, a hypothenar muscle, and patient is cyclist, and what is this? This is basically the Guyon canal syndrome. The problem, that entrapment of the basically ulnar nerve in the Guyon canal. Now I think that you will have better idea to understand that structure. So here you can see, guys. Okay, let me highlight these landmarks which I have drawn. Okay, so here you can see this is your median nerve. This is median nerve. Here 4 tendons on the roof, flexor digitorum superficialis, 4 tendons on the floor, flexor digitorum profundus. Here is your Guyon canal, which is having ulnar nerve, ulnar artery. This is your palmar cutaneous branch of median nerve, which is passing outside the tunnel. Here you have got flexor, carpi radialis tendon. Here you have got another flexor pollicis longus tendon. And then this is the structure from USMLE latest edition. So here you can see that these flexor digitorum superficialis tendon, flexor digitorum profundus tendon. Here you have got Guyon canal. This is your hypothenar. This is thenar muscle. Then you have got flexor carpi radialis muscle, and then you have got flexor pollicis longus tendon. So you have to draw this tunnel, because the risk factors are very common, and then dislocations and fractures are very common, especially the carpal bones dislocation and fractures. So you have to understand the significance of the median nerve, ulnar nerve, how these nerves are preserved, and how to diagnose the patient if anyone is having entrapment of these nerves in these tunnels. Thank you for your consideration. Thank you.